Hi, my name is Laila Hayes, and I'm a rising junior chemistry major in the dual degree engineering program with a concentration in biomedical engineering at Spelman College. This summer, I've had the wonderful opportunity of working with Dr. Paula Hammond and Brandon Johnson in the MIT Department of Chemical Engineering. In this lightning talk, I will be presenting my work focused on manipulating PEGylated PAMAM Dendrimers and comparing cartilage and meniscus partitioning to increase the efficacy of post-traumatic osteoarthritis treatments. Osteoarthritis, or OA, is a painful disease that affects up to 30 million people each year. This disease manifests as the degradation of articular cartilage and ultimately leads to the painful exposure of underlying bone. As displayed in this graphic, potential disease-modifying OA treatments via local intra-articular injection have been studied, but they have short retention times and require frequent injections. These locally injected biologics require a drug delivery system to increase joint residence time and therapeutic efficacy. Displayed on your left, previous studies have shown that cationic polyamidoamine, or PAMAM dendrimers, covalently modified with polyethylene glycol, or PEG chains, can adhere to the densely anionic aggregate chains through electrostatic interactions and improve cartilage retention times of covalently bound therapies. Meniscus tissue is capable of electrostatic interactions with the cationic dendrimer as well, and reduces the amount of dendrimer-bound therapy to the target tissue. This research evaluates the partitioning of PEG-PAMAM conjugates, as seen on your right, into cartilage and meniscus using an ex vivo bovine model. Pictured in the top left, by synthesizing a small library of conjugates, we can identify the most effective PEG chain length and chain density in order to achieve an effective accumulation in cartilage. This research uses proton nuclear magnetic resonance spectroscopy, or 1H-NMR, and a salt-based assay utilizing ex vivo bovine tissue, displayed in the top right graphic, to characterize the PEG-PAMAM conjugates. As shown in the bottom middle graphic, an ex vivo co-uptake experiment examining dendrimer uptake into cartilage and meniscus simultaneously is used to better simulate partitioning in the joint. Displayed in the top left is the synthetic protocol for attaching PEG to PAMAM dendrimers. Parentheses R indicates the repeating units of the PEG chain. Pictured in the bottom is the table providing information about the conjugates that were synthesized for this study, displaying PEG chain lengths, the target PEG chain density, and the actual PEG chain density acquired. In continuation of the previous slide, the bottom right displays the 1H-NMR graphic. Through evaluation of the data given by the 1H-NMR, the actual PEG chain density percentages are calculated by comparing the indicated PEG peak with the PAMAM peak. Pictured in the top is a schematic breakdown of the characterized properties of each conjugate. This research used generation 4 dendrimers, which have 64 primary amines. The number of covalent bonds in yellow is determined by NMR. The number of accessible charged amines in red is quantified through the data from the salt-based assay shown in the bottom left. The difference of 64 primary amines minus the number of covalent bonds and the number of accessible charged amines determines the number of non-covalent bonds between PEG and PAMAM, which is in the pink. Knowing the different properties of the synthesized PEG-PAMAM conjugates allows for us to understand their differences when performing cartilage and meniscus partitioning experiments. For all of the conjugates tested, articular cartilage, the red bar in the graphics, has a higher uptake percentage than meniscus, which is in the blue bar. On each graph, generation is abbreviated by G, PEG is abbreviated by P, and it is followed by the grafting density percentage. As displayed by PEG with 4 repeat units, otherwise known as PEG4 on the top row and PEG40 on the bottom row of the graphics, this difference in uptake, or partitioning, is more significant for PEG4 than PEG40. For all grafting densities tested. However, for both chain lengths, higher chain densities resulted in a greater partitioning than lower chain densities. These findings suggest that a shorter PEG chain and a greater PEG chain density results in more significant partitioning into cartilage. To increase drug conjugate accumulation in cartilage, the conjugate should have short PEG chains and a low number of accessible charged amines. After attaching biologic therapies to the surface of the dendrimers, we can now increase accumulation in cartilage by controlling conjugate trafficking in the joint. Thank you.